We also have another lady who is in the insurance gap, and this is Ms. Relda Manuel from Waynesboro.
Good evening, ladies and gentlemen. Thank you for coming out. I have an interesting story that is probably similar to others that probably have not been able to speak about this issue, but I wanted to relay this to you because I felt it was relevant. I used to work, but I was disabled after having a traumatic brain injury. Mine was so severe that I had to learn to talk and I had to learn to walk again. I had to teach myself because there was nowhere that I could go. I was not quite disabled at that time. I was, however, a chronic juvenile diabetic since the age of 7, and I am now 46 years old, so that makes me 39 and a half years diabetic. My story begins in 2011. My chronic disease, diabetes, became very unmanageable, and I sought a life-saving medical device from a public health facility not too far away. I received the device from the medical company about 45 days after I had eagerly started their program. I learned how to use this device really well and followed the program as closely as my body would permit me. 18 months after I had received this device, the supplier called me and demanded full payment for this device, about $6,000. Because my insurance company had denied their scheduled payments at least 2 times, though I had carefully followed Medicare's guidelines without fail. Both the medical supplier and the professional medical supply personnel at this facility had assured me that they would fight for me to get this device. I specifically asked my physicians if they had provided all of the notes, which are critical to getting the device, from my medical appointments, and they assured me that it was yes, they had. When I was able to locate a local attorney to ask about the issue, I was told I don't have a case. However, my gut said very differently. I spent about 5 hours reconstructing the multiple contacts that I had had with the medical professionals that I interacted with to try to solve this problem on my own. And the insurance company also I contacted in an attempt to resolve the problem. Finally, I faxed the information to the only place that I thought would possibly help me, because no one here in Virginia would assist me whatsoever, the White House, with the hope that anyone would take an interest in my issue. Approximately 3 weeks later, I received a letter from Region 3, Office of Civil Rights, Department of Health and Human Services, in Philadelphia, Pennsylvania. The president himself, I was told, had typed a letter and faxed it to the regional manager who had handled my case as a priority. I didn't have to fill out any form whatsoever. My health insurance company was then required to begin the payments to the supplier immediately. Talk about girl power. First thing that next morning, the insurance company calls to say that they and the facility had made a mistake and payments will be made beginning next month. All that to lead to this. Situations like mine are more common than most people might think. Discrimination happens anywhere and everywhere, and particularly to those who are most vulnerable and incapable of really helping themselves. The Affordable Care Act is a federal law that has protections in it for most of us, not all. It's not a perfect system. We realize that. It will have to be fixed eventually. But it has been chosen and offered to the majority of Virginia's population. So why wouldn't it be offered to the 400,000 who also really need it? Especially people who could have died if they didn't get the things that they need, like Nita here. and thousands, probably thousands of others that we don't know about. Patients have rights too. We deserve to be treated as equals, just as the remainder of Virginia's population do. This is a common ground state and a common ground problem. Thank you.